Hi, my name is Kimberly Fairley,
And I'm Dara Thompson.
and we are here to talk to you guys about our monthly mental health check-in. So this month we want to address depression in the month of November. And so Dara is going to give us information on what is the definition for depression.
So depression is a common, serious medical illness that negatively affects how you feel, the way you act, and the way you think. Fortunately, it is also treatable. Depression can cause feelings of sadness, loss of interest in activities, lack of joy. It can also present not only emotionally, but can also cause physical problems such as pain and inability to function at home or work. So some of the symptoms that you might experience when somebody has mild to severe depression can be feelings of sadness, a depressed mood, change in appetite, loss of interest in things that you once enjoyed, trouble sleeping. This could be too much or too little, loss of energy, and increasing amounts of fatigue, increasing amounts of trouble with physical activity, anything from like handwriting to movements to speech, feelings of guilt or loss, difficulty thinking or concentrating, having trouble finding the appropriate words, and it can also lead to thoughts of suicide or death. When these symptoms last for at least 2 weeks, that is when they usually diagnose it as clinical depression.
And so we want to make sure that we highlight some of the causes of depression. So some of the causes can be that depression may stem from childbirth. So it may be something that before you became pregnant and then you gave birth to your child as a woman, you were completely fine, and then you were having some different changes in your body. Obviously, being a mother and carrying a child changes our bodies significantly. There's also a form of depression called seasonal depression, or SAD. And with that, it's a major depressive disorder with a seasonal pattern, and it is characterized by a depression illness during the fall or winter months where there is less natural light. We want to talk about some of the other causes. Some of the other causes, and we want to make sure that we give you guys a point of reference to be able to highlight some of the things that it could be, and just to be able to give some examples. So it could be things like a breakup of a relationship or living in a conflict, a loss of a job or difficulty finding a new one, bullying or victimization, being the victim of a crime, having an accident that results in a long-term disability, the death of a partner, family member, or friend. It can also result from the effects of medication. So if a person is diagnosed with Parkinson's disease, Huntington's disease, a traumatic brain injury, stroke, those are different things that with the medication that the person is put on, that they could be suffering from some form of depression from that. It could be, again, having a baby, the side effects of certain medications, the stress of having another mental disorder, so living with an eating disorder or living with an anxiety disorder. Those are also things that can cause a person to struggle with depression. Intoxication, premenstrual changes. We want to make sure that women know, first of all, women are a lot more likely to struggle with depression or live with depression than men are. And so making sure that we know that just because of all of those changes in our bodies, it's not something wrong with you, you're not a freak, it's just simply that because of who we are and our genetic makeup, that's what makes us struggle with depression a little bit more than men do. Also, people that end up developing depression in a distressing situation, it could be because of something previously that they have experienced with depression. It could be that some people just have a more sensitive emotional nature, and people have who've had difficulty in their childhood. So for example, those who have experienced physical, sexual, emotional abuse, neglect, or over strictness. And so those are some of the things that cause different forms of depression. One of the other things that we want to highlight before we go today is, excuse me, for myself, I am a mental health first aid trainer. And so one of the action plans that we discuss for depression is called ALGEE, ALGEE. And so it's assess for the risk of suicide or harm, listen non-judgmentally, give reassurance and information, encourage appropriate professional help, and encourage self-help and other support strategies. So we're going to do a part 2 to this, where we're going to talk about some of the other ways that you can help to be able to work through depression and to be able to thrive beyond surviving. So check back with us in a couple weeks and we're gonna get that second video out to you guys. Thank you guys and have a good day.
Thank you.